here to here. This way, not down this way, but that way.
Well, it shows here like on the neck
Yeah.
too.
It is. It's from here all the way down the neck, and I stop here at the jaw, so I can't really.
So it's next to the depressor angle.
Yeah. So it's going to cover. If you look back here, it's going to cover part of the buccinator, and it's going to cover part of the pressure anguli, and comes just under the skin like that.
What's on the ear?
Here is a clip, is a cadaver. This is the diagram. All right, so let's finish up with the 3 sets of chewing muscles. 2 of them share, there's actually 4, but 2 of them share the same name. All right, so when we chew, if you look on the chart, if you can't figure it out, when we chew, what is the bone that we move? The mandible, okay? And chewing is closing the mandible. Opening is usually just a passive movement. I mean, you actually have muscles that can pull the mandible down. But when we chew, it's usually closing the mandible. And the movement that we're talking about is elevation. So closing the mandible is considered to be elevation of the mandible. You already know this is the trigeminal nerve, right? The 3rd branch. So that's elevation. Another movement is pulling the mandible forward. I don't know how that helps in chewing, but these muscles will do that. So bring your lower jaw in front of your upper jaw. That's known as protraction. And then none of us want to walk around like that, so pulling the jaw back. You take something back that you said is retraction. All right, so protraction and retraction. We also have side-to-side movement, like you would use when you were grinding your food, but we don't have a special name for that. It's just side-to-side movement. So here is the mastoid process, mandibular fossa, and our mandible. Something like that. We have our coronoid process. And we have our sphenoid bone with the lateral pterygoids. So I'm going to draw those deeper muscles first, the pterygoids, because we're going to be covering them up. And these are the pterygoids. Notice that the mandible has been cut away so that you can see the 2 pterygoid muscles. An even better view of seeing how they work is looking from the back of the skull. So here would be the vomer and perpendicular plate of the ethmoid. Here's the palatine bone and the maxilla forming the roof of the mouth. And here is the lateral pterygoid plate. Even though we have lateral and medial pterygoid muscles, their attachment is just the lateral pterygoid plate. All right, so let's say that this is the left side of the head. This would be the left lateral pterygoid plate, this one over here. So the lateral pterygoid muscle has its origin from the outside external lateral surface of the lateral pterygoid plate. The medial pterygoid muscle sandwiches it. And so both heads of the medial pterygoid are attached to the lateral pterygoid plate. The medial pterygoid is not associated with the medial pterygoid plate. Okay? So it's lateral surface of the lateral pterygoid plate, lateral and medial surface of the lateral pterygoid plate for both of these muscles. We go back to this image. The horizontal muscle is the lateral one. Comes off of the pterygoid plate, sweeps back, and wraps around the neck of the mandible. So it's going to be a little more difficult for it to elevate the mandible. It does so to some degree, but what's its best function? Protraction. You can see how when it contracts, the muscle origin is anterior to the insertion. So it's going to pull the neck of the mandible forward. It's going to pull the jaw forward. And we call that protraction. The medial pterygoid is that much better in elevation. So it's going to come down this way. The dotted line means it's going behind the mandible. And it attaches to the deep surface of the mandible, so it's going to be easy for it to elevate. So lateral pterygoid. And medial pterygoid.
Which one is on top of this?
Which, or do they just combine?
So this is lateral. Both of these are lateral. And this one is medial.
Does those help for retraction and protraction?
Well, the lateral pterygoid does protraction, and the medial pterygoid is primarily involved in elevation, and they both kind of do side to side. Neither of them is going to do retraction.
So we look at her note. It says under the medial moves mandible side to side,
Yes.
So you're gonna put protraction there,
so we can have,
You can elevation. They all do elevation.
okay,
Okay.
the other one's the.
But the lateral is the one that does protraction. This one's not going to, because this one's going to pull this way, and that's protraction.
right? Oh, wait a minute.
The
Okay.
temporalis, it says.
Temporalis is what we're going to get to in just a
I
moment.
got you.
Okay.
The lateral
Okay, so medial is elevation.
Right. It's behind this. It's behind this.
in front of.
And then next to that would be medial, and then you'd have the pterygoid plate, and behind that you'd have medial again. Okay. All right, so temporalis, you cannot see on these models very well, but you can see, okay, we have that, here we go. You can see temporalis, it's covered up by the fascia. You can see temporalis on this one. Goes this broad, almost palm-sized muscle, the temporalis fossa, comes down behind the zygomatic arch and attaches to the coronoid fossa, to the coronoid process. All right, so let me change the picture on the screen. This is the muscle, if you put your hand up here on the side of your skull and clench your jaw, you can feel that bulge.
Oh, yeah.
That's your temporalis. This muscle right here. Okay.
All the way up.
Yeah. So this muscle is going to go behind the zygomatic arch, and it's going to attach to this sharp coronoid process. Notice where I'm drawing the fibers. They start anterior or posterior to the coronoid process.
Wait. Anterior.
Posterior. So if it's pulling from here and it's pulling on this, is it going to protract or retract? Retract. So even though the temporalis, most of the muscles are straight up and down, and this is a very strong elevator of the jaw, it is the only one that protracts.
Retract.
Because, sorry, it's the only one that retracts because it starts behind and pulls it backwards.
The origin is the zygomatic arch, you said?
No, it passes behind it. The origin is going to be primarily the temporal bone. I mean, it does come off of other bones, but primarily the temporal bone, hence its name.
And it
And then you can, it protracts, sorry, no, it retracts. It elevates. and retracts.
Elevates, retracts, and
Not
protracts.
too much, it doesn't go in front of the jaw.
Okay,
So,
it's on the notes, but just want to make sure.
so it's a little bit, but it's major function. It's elevation and retraction. So Terry, here it's going behind the arch, but its insertion is the coronoid process. Okay? So we'll finish up with the last muscle. Yes? Opening the mouth are muscles that are down here in the floor, and we'll talk about those tomorrow. So if you take your thumb and put it on your jaw, okay, now push down. Feel the muscles that you use to resist that? Those are coming from the hyoid. We don't forcefully close our mouths when we chew usually. All right, it's considered, I mean, you do if you're chewing ice. When you're chewing ice, yes, but it's considered to be a secondary function. I mean, I know it seems sensible that that's part of it, but they're not considered to be muscles of mastication. Mastication is compressing the food, and opening your mouth is a passive process typically when we chew, and then we forcefully close it to break up the food. And that's the mastication process. We use other muscles to get to that point. Okay, so finally, the last one is the masseter. So the medial pterygoid was on the deep surface of the mandible. The masseter is on the superficial surface. Origin is going to be off of the maxilla and the zygomatic arch, the zygomatic bone, and maxilla and zygomatic arch. And so it's going to come in front. So I'm going to draw it in green. And if you put your hands here and clench your jaw, you're going to feel that muscle. Okay? So temporalis, masseter. And so, again, we're talking about muscles that elevate the jaw because that's what we use to actually compress, tear, and chew the food. We have to open the mouth again, but those are not technically considered to be mastication. All right, so we'll stop there. We'll do the 3 muscles of the tongue tomorrow.